So welcome to our website. Appreciate you accessing it for information. We know that some of you really appreciate that as a format and others less so, but it's really worked well for us as a way to get information out. So that's what we're doing today. My name is Ron Messner. I'm the Executive Director of Apostolic Christian LifePoints. And this information is targeted particularly toward family members. So like all of you, we just have had a pretty rough ride the last several months. So when I say that, I'm referring to residents, staff, all the pieces that are involved in that. But today I'd like to particularly try to address some of the concerns of parents and family members of our residents. I can't give you all the answers that you want. Some it's because we don't know, and other things we just don't have the flexibility to do. But we would like to help you understand and for you to know that we care about it. So as you know, when this virus hit, we were all asked to immediately shelter at home. That applied to all residential settings. And for residents, that meant suddenly no more day programs, no more shopping, no more outings, no more home visits, and unfortunately, no visitors allowed in facilities. Looking back, that seemed extremely rigid, but it perhaps was wise. It has kept things in a good place, but it was what it was. As time has passed, the governor of Illinois developed a plan, which many of you will be familiar with 5 phases for gradually easing up on that sheltering. So one of the things we need to clarify is that plan did not include congregate living. It does not include any licensed nursing homes, any facilities like that. They are under separate agencies responsible for coming up with their own criteria. So there is a discrepancy in what people who live in congregate living or a group home can do and what people in the community can do. We understand some of you have some issues with that, and we understand this. Just to clarify, we can't depart from that. If you want to address those issues, those need to go to those departments, which we'd gladly give you information on how to contact. So for healthcare and particular services funded and regulated by the Department of Public Health and those overseen by the Department of Human Services, there were significantly more stringent directives. And again, those do not necessarily line up with the governor's phases. So as the rest of the state has started to re-engage, we're looking closely at what we can do. It's been a bit in fits and starts, but some of you are aware that we've started outdoor visits with family members. We started that in what some people would call a soft opening, so doing a few here and there to see what we could manage. For those who have received the information or done it, you know that those are restricted to safe distances. We need to have staff present just to manage that exposure. We've also begun some very limited community engagement. So some of you are familiar with Camp Big Sky. We had a staff member from Timber Ridge who worked there and was able to arrange the time for just our people to be there, just our residents, so we didn't have additional engagement with community members we didn't know. And we've also used some other areas around Morton that we knew we could have controlled access to start doing some picnics or things like that. We will continue to look at those, and we're engaging every single week in looking closely at when it's time we can do family visits and how we can structure those in a way that maintains safety for you, particularly for the residents who live here, and that manage the expectation that's being put on us. So some people have asked, some of you have asked why we're being so restrictive, and I just want to say we are aware it's creating a tremendous emotional burden for residents and for their families, parents, but other family members also. So the 2 agencies that oversee us in terms of both funding and regulation have taken very different approaches. Public Health, which is most specifically applicable to Timber Ridge, Oakwood, and Linden, has been much more prescriptive. Some of that comes because they're under the direction of CMS, which is a federal agency that tells them what can occur in congregate settings. And I'm not meaning to infer we disagree with them. Sometimes we agree, sometimes not, but to make clear that we have to meet those and work through those. But we have mixed feelings about them. So just this is a reminder, or maybe just a statement of our thought process. We're very aware that we serve vulnerable people. There was a webinar at the end of last week. The director of DHS had kind of this, which you might consider, I'll say, giving 2 perspectives. I was going to express that a different way, but that's probably the most important. And she emphasized that people with disabilities are not more at risk of COVID because of their disability, but they are more at risk of getting COVID because of the comorbidity things that exist with many of the illnesses. So we have lots of people with respiratory systems that are compromised, and diabetes, and all kinds of health things. So the bottom line is, typically people with disabilities are significantly more at risk of COVID. And we know that you take that very seriously. We take that very seriously, both for your resident, the one you know, but also for the people that they live with. And so we know that's something that you share with us. It's difficult to balance the individual rights or needs with those of the other people, but we simply have to respond to both of those. So I mentioned already, the Department of Human Services has been significantly less stringent in the communication I mentioned. They both encourage us to work hard, to get out in the community, to find ways for families to interact, and then switch base and pointed out how careful we have to be and how vulnerable the people we're serving. So it leaves us kind of in a quandary of how we bring those two things together. So what does it mean for residents and their families? First, I just want you to know that we care very much about your family members' welfare. I know you know that. I just want to state that as the executive director. It matters to us, their health and welfare. And we understand it's also emotionally very distressing to them to not see family members and not go into the community. We see that every single day. We're trying to find ways to accommodate that, but we know that it's very difficult. The third point I had under this is we know we can't avoid all risks, but we are confident that you want us to do what's right to protect the well-being of your family member as well as the well-being of all the people that they live with. We want to do all that we can to safely facilitate family interaction and engagement in the community. Our goal certainly is more toward family because we know that matters more, but we know that both are important to the people that live with us. So we will continue to assess the level of risk for our residents. We're engaged in another process this week. So we look at that and we'll strive diligently to find ways to interact both with the community and with family that don't pose an unacceptable risk. We may have criteria that we put in place. Some of it you may agree with, may appreciate. Some may be less comfortable, but there clearly will be some criteria in place as we continue to advance the level of family engagement. We know amongst you as amongst everyone else, there's lots of opinions about the seriousness of COVID and about what kinds of activities create risk and what kind of interventions reduce those. We appreciate the patience you've shown for us, and we need you to continue to work with us as we seek for answers and decisions. Our commitment is to work with you to try to do what we can within safe parameters. And as always, we appreciate your prayers for what we're doing, but also specifically for wisdom as we make decisions about re-engaging, and prayers for the welfare of your family member and the welfare of all those who live with us and our clients. Thank you.